Ladies and gentlemen, good morning and welcome. Welcome to our webinar on, aerobics and calisthenics. Today is the 21st of March. It is 11 a.m. in the UAE and 12:30 from where I am speaking with you, and that is from India. Now, you may wonder, why is it that we talk about the same thing time and time again in our weight loss challenge? We don't talk about the same thing all the time, but we do talk about exercise and diet all the time. And there's a good reason for this. The reason is that these are the most basic components in weight loss, the most basic components. The rest is information and frills. Of course, valuable information about medication, valuable information about surgery, valuable information about comorbidities, and so on and so forth. But if you are to look at the primary manner in which you could manage your weight or lose weight, then time and time again you will need to repeat and emphasize exercise and nutrition. Now, in our previous years, and this is our 5th year, in our previous years, we have spoken about the Western forms of exercise, walking, swimming, weight training, and so on and so forth. We have also spoken about the Eastern form of exercise, yoga in particular, with a mention of Tai Chi, and so on and so forth. So you begin to wonder, why have you picked the topic aerobics and calisthenics? Well, the answer to my mind is simple enough, but of course, I will wait for our expert to guide us. But my answer seems simple, that aerobics is primarily thought to be beneficial to the heart, and so it is. It burns calories, and that is the reason. It burns calories and helps you to lose weight. So that is an important reason. Why calisthenics? Calisthenics is a system of exercise by which you use your own body weight to improve your strength. A simple, straightforward explanation. But what does that have to do with weight loss? The connection is profound. The greater your muscle capacity, the more muscles you have, the deeper the intensity of the muscles you have, the higher your metabolism. And so aerobics and calisthenics are twins that you need to deal with together when talking about exercise. But we have a seasoned speaker to talk about this subject, an individual who I have known for the last, I will say 20 years, because it could be more, but I don't want to age Dr. M. So I will simply use the word 20 years and more. I have known Dr. Madhurima when we worked together in India in the prestigious Indraprastha Hospital. I have known her when she was the chief consultant and the chief counselor in the diabetes clinic, which was in Dubai. We couldn't do without her, and therefore she worked with us for several years and is still associated with us in Ras Al Khaimah in our Arabian wellness and lifestyle medicine. But Dr. Madhurima did her BHMS in 1992 and then completed her postgraduate diploma and in preventive and promotive healthcare and lifestyle medicine. She also did a fellowship in lifestyle medicine, and all this is from the prestigious Apollo Hospitals and Education Research Foundation. She is a diabetic educator is the right word, from the International Diabetes Federation. And is, in addition, most relevant to today's subject, she is a certified fitness trainer from the UAE and other locations. Over 20 years of experience in the field of health and wellness. And she has worked, as I mentioned, in Apollo hospitals in India. She has worked in Dubai in the diabetes clinic, and she has worked with RAC hospitals in Ras Al Khaimah. Currently, she has her own organization, Pro-Life. Her main field of emphasis is unique and modern. She talks about promotive medicine. She talks about preventive medicine. She talks about health and wellness and diet and exercise. And there is no better way to spend the next hour than with Dr. Madhurima. Ladies and gentlemen, I present my dear friend, Dr. Madhurima.
Thank you so much, Professor. And your ever encouraging words all the time, all those years, you're always being there for me and for others also, and encouraging us. Sorry, can you hear, sir?
Yes.
Yes. Okay. So yes, I was just thanking you for your all encouraging words, and yes, we all appreciate you. So having said that, now, hello everyone who has joined for this webinar. I welcome you all. And today, I congratulate also for taking participation in our RAC Biggest Losers Champion challenges and taking these steps towards a healthier you. So yes, it is going to be very useful for your future journey in your health and weight loss. So here, let me share my presentation, and then we'll talk about fitness or exercises and their role in obesity and weight loss. Okay. All right. Okay. Is this fine? Can you see everyone?
Yes, doctor.
Okay, thank you. Okay, all right. So today we are going to talk about exercises for weight loss and obesity. So in this is just an overview. What we'll see is briefly touch upon what is obesity, then what we can do to lose weight, and then talk more about exercises. Exactly what do we mean by exercises, little science behind that, and what is the ideal sessions or ideal format we should be following to reach up to our goals. So what is obesity? So obesity is just not a cosmetic problem. So, but it is a major health hazard. It is affecting the quality of life of those who are really obese or overweight. It is classified as a disease in itself, and also it is a root cause of many more chronic diseases, virtually every other condition, or virtually affecting all the systems of our body. So it is defined as excessive deposition of fat in our body. But why do we need fat? Why there is a deposition of fat in your body? Why we are not depositing carbohydrate or proteins or stuff like that? This is our nature's safety mechanism. So nature is storing energy in the form of fat. For those days when we don't get food, we can use this stored energy from the fat and sustain ourselves. So this is a really beautiful mechanism, but the problem arises if there is an excessive amount. So anything in excess is really not good. So same way here, when we start consuming more calories and expending less and less, then the stores of fat or energy is getting accumulated in our body and giving rise to giving rise to obesity and so other problems. So why this occurs is, yes, majorly it is because of our faulty lifestyles, the way we eat, the way we move nowadays, all the stress, environmental factors. And there are some complex problems also, like genetic factors or combination of all these factors, metabolic factors, your endocrine, your thyroid, or mental stress, because mental stress also gives rise to more cortisol. So cortisol is a hormone, is known to giving rise to more storage of fat cells, and some medication. So all these factors play in the role of obesity. But among this, what I will say is we should be giving more importance to the visceral fat or the abdominal fat. So visceral fat is nothing but the fat which is accumulated surrounding our internal organs, like our intestines, liver, pancreas, or even heart. So why this kind of fat is more, it is more dangerous is because the fat, this is known to give us low-grade inflammation. That means it causes inflammation in our body. And this in turn gives rise to heart attacks, or your effects on your liver, and effects on your metabolism also, and the vicious circle starts. So because of fat, body is giving rise to inflammation, and because it is inflamed, because it is not working properly, again that there are the fats deposition is happening. So this is a little science for behind the fat cells. So we must know our measures. So we all know about BMIs, height and weight ratio, your hip to waist ratio, fat percentage, and the simplest form is now your waist circumference. So your abdominal girth, or at the level of your umbilicus, it should not be more than half of your height. So your height, make it into half, maybe inches or centimeters. That should be ideally your abdominal girth. So this is just one pointer for you to know about what grade of obesity you are having. Okay. So let's see what happens if we have all this inflammation in our body because of our fat. So here, as you can see, it is practically affecting all our systems of our body. So start with type 2 diabetes, because it affects your glucose uptake and the insulin metabolism. It hinders this insulin process of taking up the excess glucose in the blood, and gives rise to type 2 diabetes. Then coronary heart diseases, stroke, high blood pressures, cholesterols like bad cholesterols like LDL and triglycerides. And also it is a cause for low good cholesterol, that is HDL cholesterol. So it's a both ways. Osteoarthritis of joints, and especially for the weight-bearing joints like your knees, ankle, hips, etc. Low back pain, sleep apnea. Why sleep apnea happens? Because there is your abdomen is distended, the girth is more, and when you sleep, the abdominal contents of abdomen are giving pressure on your diaphragm, and which in turn giving pressure on your lungs and your breathing. So this is the reason for sleep apnea. And again, for this same reason, it will give you GERD, that is gastroesophageal reflux disease. The contents of your stomach are going up into the esophagus, which should not be going. So, and all this acid is giving you heartburn or acidity. So all these conditions are happening just because your weight is more. Of course, fatty liver, we are consuming so much, so your liver is being, even if you are not drinking, it will give you non-alcoholic fatty liver disease. And liver is a powerhouse, or all our body's enzyme, every chemical process is having in the processing in the liver. So that function is getting hampered. Also, it affects your mental state also. So we have seen many cases of depression happening majorly because of the obesity. So this way, we have seen the high percentage of fat or obesity is going to affect you all over as a all your body. So it is our uh, duty, or it's time that we must do about this and take control, and we have to have some weight reduction strategies. And let me tell you, even though you will feel it's so much of a task to do, but you can be assured, even if you lose your weight by 5 to 8%, then all these bad effects are gonna come down. So at least aim for those. Every session or every 3 months, going for at least 5 to 8% of weight reductions. So what we can do to reduce our weight? Now, as we have seen, it is caused due to so many factors. So we cannot have just a one point approach, or we'll say, okay, I will eat less and I will lose weight, or I will just go to gym, I will work out and I will lose weight. This kind of approach is not going to help. We must have multiple or multi-pronged approaches. So what are those? Yes, of course, first is your diet, because calorie in and calorie out. So how much calorie you are putting into it and how much calorie you are dispensing with your daily activities and exercises, that is must. So be calorie conscious. You have to be calorie consciousness. And whatever you are eating, the food you are eating, that has to be nutritious. It has to have all the components of nutritious food, that is protein, carbohydrate, fat, vitamin, and water into a balanced amount. So first is, yes, your nutrition, and of course, not going for any fad diets. So many, there is a WhatsApp university. There are so many people, influencers telling you to do this diet, that diet, and weight is lost within 1 week, 3 kgs lost. Please do not fall prey for all those things. So take expert advice and take the decision which is right for you. So yes, diet, then exercise and physical activity, that we are going to talk in detail as we go further. Then we have to modify our lifestyles. So that includes your sleep. Sleep is very, very important even for the weight loss. People must be thinking how sleep is related to obesity, because when we have less sleep, then, or we usually, this is because of the stress and other factors. So less sleep means more cortisol levels in the body, and more cortisols are giving rise to increased storage of fat. Because why? Fat is stored because it is acts as a defensive mechanism. Body thinks something is going to happen, so it has to be prepared with his food storage and etc. So also it causes slow metabolism. Saying no to habits like alcoholism, because again, this is all calorie rich foods. So you must know what food is giving high calories. And this ultimately gives rise to more weight. Of course, then there are some medications which you can help you in your reducing weight, and surgery like bariatric surgery, etc. But these are the extreme measures, and very few people will need them. But what I will say, I know nowadays medication is taking a forefront. Everybody wants quick result. Everybody wants to go for medicines. But I recommend you only one medicine which is going to be truly helpful for you, that is exercise. Yes, exercise is the best medicine. So exercises not only will help you on for your body or for your weight loss, but is also going to be good for your mental state or your mental health. So how? We'll just see that. Yeah, so people tell me, my work is such that I roam about in my at my work. I have to walk so much. I have to climb stairs. I will like practically I'm walking 5 kilometers or so at work itself. Then they say then I have to do physical manual work. The homemakers say the whole day I'm working. I have children. I have to look after. Yes, you all are doing all this work and spending energy. So by doing this, you are being active and you are spending energy. That is good. But even with this amount of your activity, there has to be something called exercises. So what are exercises? So exercises means it's a planned, structured, and repetitive body movement. What they do is they improve the fitness of the muscles, ligament, tissues, and thus they improve the optimal capacity of the body. Because doing one like lifting weight for once is not going to build your muscles. There has to be repetitive pressure. There has to be load on that. And then only there is like we say there is a micro tears in the muscle, nothing to be worried about. That is how the muscle grow. And that is how the capacity of the muscles grow. And even for the tissues and ligaments, the stretching part, that is all going to help your body, your joints, your muscles to be in alignment and improve their capacity. So structured exercises is must, even though you are active and busy whole day. And the good part for this structured exercises is that you don't have to take out too much of a time. So even doing exercises, let's say for 2 or 3 days, is going to be very, very useful for you. So yes, activity and exercises are must. So what are the benefits of exercises? Oh, there are many, many, many. I can't stop counting all those things. But yes, majorly now, because we are talking about weight loss, yes, it is going to be helpful in weight loss. And not only weight loss, after the weight loss, if you want to sustain that weight loss for a long period of time, then you must be doing exercises. Many times people only do diet part. So when the diet period is over, the weight rebounds because they are not doing anything else. They are going about their life as it was before. So again, those weight comes back, but not with the exercises. If you are exercising regularly, even if say you are regular with all the components or whatever your session, you have been doing this consistently for 3 months. And after that, even if you stop for, let's say, 2-3 weeks, even for that period, you are going to get the benefits of exercise, what we had done previously. So your weight will not come back, rebound back just like that. It is still giving you those benefits. And it is your duty to start again so that it is not, it is going to go sustained further and not, the weight should not come back. And also muscles has a muscle memory and they pick up fast. So you don't have to start from the beginning. So that is a beauty of exercises. Okay. So I have highly recommend you to do the exercises. Okay. So the first benefit is weight loss and maintaining of the weight loss. Then exercises affect all the systems of our body, because some exercise like cardio, they are for your heart and lungs. Muscle, then stamina is for your muscles, stretching is for your joints. So when we are doing all these exercises, what is happening? There is a good circulation, there is a good amount of oxygen, and all this is providing the good nutrition to every cell of the body. So this way, bodies is getting enough oxygen and nutrition and maintaining its health. To read the more benefits, see how it helps in reducing high blood pressures, because our arteries are healthy, they are elastic because we are doing exercises. Reduce risk of type 2 diabetes. Insulin metabolism is increased and the uptake of glucose is more when you exercise. So less heart attacks, strokes, even several forms of cancers. Increase in HDL. It is a major row of exercises. HDL will not be increased by any other uh, means more as it is by exercises. So if you want to increase your good cholesterol, exercises is must. Strong muscles, of course, strong muscles, bones, reduce arthritis as you reduce your weight. The weight has your gravitational pull and the weight has reduced. So your joints will be thankful for you. Reduce risk of osteoporosis and falls, reduce symptoms of depression and anxiety. Mental health is improved. How? Because after the one good session of exercises, our body releases endorphins, or our brain releases endorphins. The second name of endorphins is happy hormones. You literally feel high after doing exercises. I wish I can demonstrate you here in itself, but please try at least 5 minutes of good session and you will come to know the difference between before and after, how your mental state was. So exercises affect your mental state also. It improves your sleep and thus they reduces chances of your depression, anxiety, that is going to be reduced. So keep in mind, yes, for mind health, exercise is must. Of course, and it boosts brain power too. As I said, good nutrition is going to brain and oxygen is going to brain. So your brain power is also going to be more. Better digestion, improve immunity. Yes, your skin looks better. It is all nice red, and that is you can say it's a bonus you'll be getting by doing exercises. And all this is going to enhance your self-image. You will be much more confident. So I think this is all enough motivation to exercise and not only just have one point focus that, oh, I have to wait. No, wait, yes, important. With that, all these things also you are going to get. Okay. All right. Okay. So how much exercise is needed? So it is, we all know it is recommended that at least 30 minutes of brisk walk every day for 5 to 6 days is recommended for maintaining your health or regular health. But if you want to lose weight, you have to increase this amount. So at least 1 hour per day. This you can split into morning and evening also. But try to have 1 hour of walk or cardio exercises. And with that, at least 2 days of muscular exercises or muscle training exercises, maybe with weight, maybe with your own body weight, or maybe in the gym. So minimum this much amount is required if you are serious to lose weight. All right. So let's see how we are going to do exercises and what is the science of exercise. Because just like our nutrition, we know that we have to take a balanced diet of different nutrients. The exercise is same way. Many people say, I walk a lot, but I don't lose. There is no no change in me. That is because we had to know what is that exactly our body needs. So these are the components of our fitness program. So there are major three programs: stamina, or they can be called as cardio or aerobic, then strength, or for your muscles, that can be your calisthenics, and flexibility exercises. Those are for your joints and for ligaments and overall fascia. So we must be exercising with all these three components in mind. And these help us in managing our heart, lungs, muscles, joints, and ligaments, and our balance also. So let's talk about stamina or aerobic exercises. So stamina exercises or aerobic exercises or cardio, why these are the names? Because when we do these exercises, we need oxygen. So oxygen is needed to do these exercises, and oxygen gives the energy to produce energy, and we do these movements. And they are mainly for your heart and lungs. So what kind of exercises are those? Are simple like walking, jogging, cycling, swimming, aerobic exercises, doing Zumba, etc. All this exercise, what they do is increase our heart rate and increase our rest, and thus they are increasing our circulation in our body. How much we should be doing this? 5 to 6 days in a week is must. Duration could be 30 to 60 minutes, depending on your requirement. Okay, if you are obese, then of course 60 minutes. If you want to just maintain your weight or reduce a little bit, you can go for 30 minutes. And of course, I will talk about intensity a little bit more. And now, because we are talking about obesity, one must remember what to do and what not to do. Because a lean person doing exercises and an obese person doing exercise is little different. Because of the weight of the body, some exercises are not good for you. They will be putting more pressure on your weight-bearing joints like ankles and your knees, etc. So you must be careful of choosing what kind of exercises you are doing. So in aerobics exercises, what you can do? Yes, simple walks you can do, but not the running or jogging. And especially if you are a beginner. If you are a beginner, you must go slow. You just can't go one day, okay, I have put on your shoes and just start running. No, that is going to hurt your muscles and ligaments and your joints. So walk, brisk walk. Oh, that is not a leisure walk, but it's a brisk walk. Then other exercises could be aqua exercises or exercises done in the water or in the pool. So there are so many varieties of exercises can be done in the pool, or simple swimming also will do. This I will recommend for morbid obese patient in the initial stages. At least they can do the aqua exercises. Then there is light exercises to the music. Those who like music and this, they will definitely feel good doing these exercises. Just see that you are not going high intensity in this. High intensity means going like very fast, doing movements, doing very fast, or jumping jacks, or doing the movements where you are out of breath. Here you are going into anaerobic state. That is, your body is not using oxygen to do this movement. And this is very, very fast movements and very high impact movements. So avoid those, but leisure with music and moderate intensity, of course, you can go. So you can do aqua exercises, music exercises, simple march. Simple. People say, I don't have time to go to gym. I don't like to do any certain kinds of exercises. So if you have lack of time, just at your home, you can do simple marching like this lady is doing slowly. Even that is going to do you some good. Then again, this has shown the using chair as your prop. And using chair, you can do so many exercises which are low impact. Here, the lady is doing the squats. So those who are obese or morbidly obese, doing full squat is not recommended. These are not good for the knees, but they can surely try slowly doing the chair squats. In the gym, if you are going, yes, you can try this elliptical trainer. That is a cross trainer that is good on your knees. Try to avoid the treadmills. Okay, so these are the just some examples of what you can do if your weight is too much. But this all can be done very well. That keep you in mind. So at what level this aerobic exercise we must be doing? So there is certain formula for that. So formula is 220 minus age will give rise to maximum heart rate. And calculate this maximum heart rates to 60 to 90% of the MHR. So you should be doing somewhere between at least 70 to 80% of your maximum heart rate. If you don't want to go into these too complicated things, what you can take a cue from your own body. How, if you are walking, walk at a pace where you start to have little breathlessness. Your breath is going up, but not so much that you are panting. Don't go to that level, but little breathlessness and you are started to perspire. The sweat is coming. So maintain that stage for at least 20 minutes. So that is good enough for you to have your cardio session or your aerobic session. Next is strength exercises. So like I said, strength exercises are for your muscles. Why you have to do muscle exercises? They say, I don't want to have six-pack abs or something. Why I need exercises for muscles? Because good muscle mass means good resting metabolism. Good metabolism means you are spending energy more. So whatever you are eating, the major part of that energy is utilized by your muscles, and it is not going to be stored as a fat. So if you don't want to be fat, your muscles should be good. It's okay if you have a higher weight with muscle, but we don't want the fat in that. So we have to improve our muscular health. Yeah, and of course, so even the good muscles take up more glucose. So for the diabetic also, having good muscles is very, very important. Then how we can improve or how we can do these strength exercises? We can do them with your own body weight, with some gym equipments or free weights. There are so many ways we can do it. So those who don't want to go to gym and because maybe they are intimidated or they don't know how to do the exercises, or they don't have time to go. So they all can start our calisthenic exercises. So calisthenics exercises are meant for a muscle group of developing muscle groups, and we are using our own body weight to do them. So what kind of exercises we can try is like this. So again, for the beginner, there are thousands of exercises from which you can choose of. If you are beginner, you have certain set of exercises, intermediate level, and then expert level. So you have to choose the exercises according to your body capacity. Here I'm talking about for beginners, because again, like I said, you don't want to injure yourself. So you have to go slow. You have to go from the beginning. So use your body weight. Major body exercises are push-ups, sit-ups, and squat. Only these three kind of exercises they are using multiple muscle groups. They are multi-joint, they are using multiple joints. And this way we can cover the whole body exercises. So but again, here there are so many variations. The proper way of push-ups is, we all know, getting down on the floor and doing the push-ups, which everyone is scared of. And that is a challenge everyone gives to each other. How many push-ups you can do? Okay. So don't start with that. You can start slowly, gradually, like wall push-ups or incline push-ups. You can start, as you are seeing on your screen, you can start with that. Then the squats. Again, for the squats, I have said, use a chair if you can't do more, or you can use wall also. You can do the wall sits. Then there are crunches. Again, crunches, go slowly. You can start with the leg raises, and then other is the dips. This is for triceps. And the other, I'm just showing how, just using a double bar, there are so many varieties of exercises we can do for different groups of muscles. So we have all the means to do exercises. Even our door frames at our home, use the door frames, and we can do so many exercises with that. So what I'll say, there is just no excuse for not doing exercises, or just can't say, I don't have time, I don't have gym nearby, or I don't like gym. Everything can be done at home. So having said that, I am not against going to gym or going outside. That has a tremendous use too, because after certain level, after you are graduated from your beginner level, you must have somebody to take you forward. And even now, don't do all these exercises just as it is. Take some opinion, at least, to know the correct techniques of these exercises. Okay. So how many times we should be doing this calisthenic exercises? His frequency is maybe just 2 to 3 times in a week. But see that you're utilizing the whole body. So you can, one day you can do upper body, one day you can do lower body, and one day you can do whole body. You can, depending on your time, or you can just go for 2 days of whole body exercises, exercising all the muscle groups in an hour or so. So frequency is not much. You can have just 2 to 3 times in a week. Intensity, yes. Intensity is a repetition. When you begin slowly, maybe just go for like 8 to 10 repetitions and have 2 sets. But as you go along, maybe after 2 weeks, you can increase this intensity by doing more repetitions and more sets. And gradually, then you can use small free weights too in this. Okay. Then comes your flexibility exercises. Flexibility means these are for your joints and ligaments, and of course, all the fascia of the body. Okay, why this is important? Of course, your joint health and your balance. Yes, as we grow older, or even before also, when we are doing some quick movements, we see suddenly people fell down. Why? Because this balancing on your knees or your ankles is getting less and less, because those ligaments are getting rigid and they are not as elastic, you can say, or supple. So of course, and these exercises are also good for having a good circulation in body. So there are 2 types of flexibility exercises, like mobility and static stretching. So mobility are the exercises for joints. So let's say start from neck, take each joint of the body and you can go downwards towards your legs. So from neck to toe. And what you have to do is, I won't say it's exercise. Here, you have to just use the full range of motion of these joints. So for neck, if you see, maybe this left and right, up and down, and circular motions. So these are the motion of this joint. So recognize the normal movements of each joint, and we have to do those repetitively again for 8 to 10 counts. Okay, so these are mobility exercises, and these mobility exercises we can use as a warm-up exercise too before your main session. And then there are static stretches. Here, what we do is we stretch a group of muscles for at least 20 to 30 seconds, like it is shown here, like a quadricep stretch or your like this tricep stretch. We are stretching this muscle and we are holding it, because after a vigorous exercises, your body needs to cool down, because muscle actually become warm. They are contracted. So we need to loosen them. We need to make them cool. So these static stretches are very, very important, and hold this stretch for at least 20 to 30 seconds. Okay. And this will also reduce the pain sometimes we get after exercises. Doing this cool down session will reduce those pains. So we have talked about the components of exercises. So remember this fitness pyramid. Just observe the large part of our daily routine is going into doing the household chores, cleaning, doing household things, going to school, going to office, cleaning, etc. Then comes playing games or doing some structured activity. This can be done, comes under the exercise part. So this is the cardio. This is what they are doing is mainly cardio. This is for 5 to 6 times in a week. You must have some vigorous cardio activity, or I can say some moderate level activity for this obese patient. And then there is strengthening or mobility and strength, at least for 2 to 3 times in a week. Mobility is every day. Mobility every day we must do from morning to evening. We have to loosen up our joints and keep our circulation going. And yes, your leisure time is only so much. You can just lie down on your couch and maybe Netflix the whole day, because Netflix does not give you time also to get up. It just start the next episode. So you have to come out of that. Again, this is one menace of the modern time. But yes, the screen time we have to limit, and limit having sitting at one time for a longer time. Even this is true in your offices also. Try to get up at least after 1 hour, do some stretching, do some mobility exercises. That is going to do good for you. Okay. All right. So we know about the exercises, what kind of exercises, and how much we should be doing, and why we should be doing. Now, how to start? For the beginners, all this will seem, oh my God, it's like how to do this, how I'm going to manage all these things. But let me assure you, it can be done. Everyone can be done. And just start positively, and automatically it is going to get into you. You will get into the groove. But first, start slowly. Start simple, like, okay, start with the, if you are not doing anything, at least start with the walk. Because previously what you are doing is going to the grocery store and coming back. No, Now have some particular time. Start with the 15 minutes itself. 15 minutes I'm going to walk, and in that 15 minutes, at least 10 minutes I'm going to walk briskly. That should be your beginner's goal. Then use chairs which you have at home. You can use those chairs and start doing other exercises, calisthenic exercises. If you don't want to go to gym, then choose the activity which you like. Going out in the nature and doing walking is good for some people. Some people like to go to gym. Gym is the environment they like because there are other people, they get motivated by them. Then there is a yoga. So you can choose yoga. So there are so many options for you. Choose the activity which you like so that you can do it for a longer period or you can sustain it. Set small goals, daily goals. Okay, today 15 minutes. Next week I'm going to do 20 minutes or 25 minutes. Yeah, and don't try to do too much too soon. Like I said, it might lead to injury. And yes, consistency is the key. Not doing, oh, today I did exercise for 1 hour. Now it's enough. Now I can, whole day I can rest, or I will do after now 3 days because my trainer said take rest. There has to be some resting days. So I'm going to take rest for 2 days and then, no, it is not like that. So be consistent, come what may. Even if you don't have time to do for 1 hour exercises, at least 5 to 10 minutes, you must do some activity, choose some activity, do some high intensity activity, but see that you have done that your session or you are done the time you are given for the exercises. This way, your mind will also get used to this routine. So having consistency is must. And whenever you do your exercises, remember what we talked: stamina, strength, and mobility, or aerobics, calisthenics, and your mobility exercises. Yes, and if you are going for a walk or jogging, see that you have wearing proper shoes, because with obesity or with your higher overweight, your legs are taking major pressure on them. So have some well cushioned and well fitting. The fit should be good at your ankles. So give importance to your shoes. Have good walking shoes for your exercises. Yeah, exercise immediately. Yeah, don't exercise with your full stomach. And after exercises, you can have little nutritious snacks, but not much, not like a fatty food. Okay, that your nutritionist will tell you what to do. Okay. How does a ideal whole body fitness session should look like? First is warm up. It's very important that you do warm up, because if you go suddenly and start doing exercises, it's gonna be very injury. There could be injury. Why? Because our muscles are practically cold and there is no circulation. Just a second. Yeah. So it is important that you have to do warm up. In that warm up, what we can do is our mobility joint exercise. Like I said, from neck to toe, we can take all the joints and we can do this exercise as a warm up. Then do major muscle groups. Maybe start with lower body. So exercise your like squats or your calf muscles, like lunges. This will take care of your major muscle groups. Then upper body exercises, like again, maybe pull-ups, chest presses, or push-ups. If you are using body weight, then squats and push-ups. Then core muscles. So crunches or leg raises, alternate leg raises, that you can do. So this way we are taking care of the whole body, and see that you are using equal and opposite muscle group. Like if you have done your exercises for, let's say for the bicep, see that your triceps is also getting exercised. That should be like a ideal session. Then after this, your session, cool down. Again, this is very, very important. So while cool down, what you have to do is stretch your muscles, like I said, at least for 20 to 30 seconds, each muscle group. Why this is important? Because after maybe 1 or 2 days, you will get some pain after the exercises. This happens because there are micro tears in our muscles, and these are really good, because that is how the muscle growth happens. Hypertrophy of muscle happens because the new nutrients are going there, and this is helping to build the muscles. To prevent that pain, because that will be there, but the soreness and the pain will not be so much if you stretch. So that is called a delayed onset muscle soreness. So this muscle soreness will be less if you stretch. So warm up, main body exercises, and cool down. And with that, remember to breathe. Each exercise has a breathing pattern, breathe in and breathe out. So you must have give the importance to your breathing also, because simply holding breath and doing the exercises, no, again, this is going to lead some injuries. So simple breathing, what is required, how to go in and out with the breathing pattern, steady breathing is also important. All right. So after doing all this, you have done your program, everything is going well, the month has passed, you have reduced maybe 3 kgs. Then after 2 weeks, nothing is happening. Nothing is budging. The weight is same. Why this is happening? So this is called a plateau of in your weight reductions. Sometimes this phase does come, because in the initial phases, lots of water which is retained in between our cells is getting rid of, and body is having so much stimulant, the reduction of weight is more. But as the time passes, weight is less. So now body thinks, oh, this is something going into the like a famine, or my body is losing weight, means I have to protect it. So it slows down the metabolism. Plus, maybe you are become complacent and you are not doing as you are doing previously. Sometimes you are missing your exercises session, or in your diet you are doing something not good. So all these factors come into the play, and there is a plateau, or the weight is not reducing as we liked it. So what you have to do for in this session, in such cases? Yes, first of all, determine the cause, why this is happening. Just see, maybe write a journal, see what you have been doing wrong now compared to the previous one. Plan meals, snacks, portion control. See that you are having consistent meals, and which are of good quality, and not having too many cheat meals or too many celebrations because you have lost weight, because that is what the mindset is. Now I have 3 kg less, so I can eat this much now. So this much and this much frequently, how many times that is happening, this all matters. Most importantly, increase the amount of exercises. Now is the time. You cannot say, I don't have time, or I cannot do. No, this is the time you must put in extra efforts. increase the time for exercises or increase the intensity of the exercises, because now you have been doing those, you know what to do. Now you are in the intermediate level, so you can increase the intensity of your exercises. Okay, and try to enjoy other things also. If you like doing only yoga, go for gym, go for the weight training, go for swimming, go for your cycling. So shake things up. Doing something extra or doing something different than what you have been doing so long is going to put a good stimulus on your exercise, on your muscles or body, and that is going to help you. Yes, so all these things you can try. Yes, you have to keep motivated, and yes, watch for the gimmicks. Nowadays, you have to be very careful to whom you follow and which influencer is giving you what is solutions for the quick fixes. So just be mindful of those. What other things you can do to make you stay motivated and keep you in the track? Yes, as I said, do what you enjoy. Make an announcement. Yes, whenever you are starting your program, tell all your friends, everybody, that I'm doing this. So when they ask you what happened, why you are not going today, so at least there is little bit guilt and to come back again to the routine. That helps. Do not have all or nothing mindset. Yes, this is very important. So there will be some days, that means that those days we really don't have time, too much time, but still 5 to 10 minutes, whatever the reason, we all have, and we can squeeze out that during our whole day. So in those 5 minutes or 10 minutes, try to do as much you can. What you can do is simple, or marching, jumping jacks, doing your whole mobility routine, wall push-ups, chair squats, taking a stair, so many things. So don't have this all or nothing mentality. That means I will do exercise only in the gym, or no, this is not good. You squeezing whatever time you have, and so many exercises are out there, you can do it. Okay, keep your gear visible. Yeah, this is for those who are like, in Hindi they say kal se. I will exercise from tomorrow. Okay, today I'm not having mood. Yesterday I didn't sleep well, so today I don't want to do anything. So for those people, one trick helps is keep your shoes, your water bottle, your gym bag, or or your yoga mat, whatever you are doing. Keep these things somewhere where they are always visible to you, and not the cupboard or behind the cupboard. No. So looking at those things, you will at least sometimes will feel motivated to do the exercises, because they're always looking at you. So that helps. And if you have a treadmill, you have to use it, but not to put clothes to dry out. This is the classic thing I have seen in many homes. So please, I hope you are not doing that. So track your workouts. Yes, keep a journal, and note down what you have done. So this again gives you have your in front of you how much you have done and when you are done. So if you have done less, you are motivated to do it more. And of course, take support of an expert. If you have a trainer or somebody with you, that person will be accountable. So he will be pushing you all. So try all these methods and whatever suits you best. Main thing is keep you going. All right. Yeah. So this is the motivation you will be getting. All right, so you are doing everything good. You are doing all your programs, but while doing that, be mindful of some conditions. That always take a medical clearance or talk to your healthcare provider if you have morbid obesity. That means your BMI is more than 40%. Take a clearance. If you have diabetes, check your blood sugar levels before and after your workout. Keep some sugary snacks with you. And of course, take permission from your doctor. In hypertension, avoid lifting heavy weights. Don't do too much of overhead heavy lifting. Keep hydrated. Heart ailments, in those cases, pay attention to your dizziness, pain, palpitation, fever, chest pain, irregular heartbeat. You should know, be aware of all these things. You can just stop then and there if you have some of these conditions. Yeah. Of course, after surgery and pregnancy, you have to take permission from your doctors. If you have pains, if you have a severe backache or injury of some kind, don't go overboard. You can do the exercises which are not a part of that. Suppose if you are having a knee joint pain, you can do the upper body. No harm in that. But don't push yourself and do the whole program with your knee joint. That is not good. Let there be a complete recovery. Then only you can start the exercises. So keep all these things in mind. Yes, that's all today. So thank you very much for listening to me. I hope it was helpful in any way. Yeah, thank you. Over to you, Professor.
Dr. M, Dr. Madhurima.
Yes, sir.
Thank you so much. I have long been trying to understand what we can do when we reach the plateau. I have only recently been asked by friends, I've reached a plateau, what should I do? And I must tell you that I was not happy with the answer I provided. I looked at it from a scientific perspective. I suggested a few things here and there, but one sentence in your slide caught my attention, and I believe that is the solution. When you spoke about plateaus, you simply wrote beside that, shake things up. Excellent. Excellent. I think that is an excellent solution, which means at any rate, you will have the psychological satisfaction of doing something different. We will confuse the body, and the body will need to get down to finding solutions. You're absolutely right. You said shake things up. You may be following an excellent diet, but change it. You may be doing some form of exercise, but modify it, change it, make it different. I believe that is truly a good answer. And in due course of time, that will become standard, and you would need to change that again. So I think shake things up is an excellent solution that you have provided to me in the perspective of knowledge, and I am deeply grateful. Thank you very much. Thank you very much, Dr. M. Dr. M, that was an excellent talk. Being in the field for the last 50 years, I always believe that I think to myself, I wonder what else I can learn. And I am always delighted to learn new things. Thank you so much for this. Dr. W, I'm sure we have questions. I can see several questions out there. I hand it over to you, sir.
Yes, sir. Thank you so much. First of all, thank you, Dr. Madhurima, for a wonderful session. You started with the preliminary, the first your exerciser doing the exercise, then you went into moderate level, then into extreme level, then how to sustain what you have lost. That was wonderful. The complete exercise program is mentioned. So thank you very much for that. Yes, we can start taking questions. First question, yeah, this is very interesting because you have given one aspect, and I think the Orhan is asking. It was interesting to know about the types of exercise. What is the time ratio of these type of exercise? Means how much? I think what he's asking is how much time you should be spending on each type.
Time for each exercises or just
I
in
think
general?
he's asking about the components.
Yeah, see, we talked about the components like stamina, strength, and mobility. So if you start with the stamina, like I said, 30 minutes just to maintain your health ratio, you have to do 30 minutes at a stage is must. But in that also, if you're doing high intensity exercises, that means those can be done only for 5 minutes, but they are very high intensity. I didn't talk more about high intensity because we are talking for the obese people. So that they are not really good for them. So yes, time component for a normal person, cardio exercises 30 minutes to 1 hour, brisk walk or in a moderate intensity. High intensity, 4 to 5 minutes. That is part. And then comes your strength or the calisthenic part. So each exercise, what we recommend is for doing beginners, we say do 2 sets of, let's say, 8 to 10 repetitions. That's it. So that hardly takes less than 5 minutes. But as you go further or you become intermittent, this number of sets gets increased and number of repetition also gets increased by 15 to 20 and number of sets will be 3 sets. That is just roughly roundabout. So this is the component and mobility exercises, like I said, it should be done every day, every morning, every evening also, just 2 to 3 times also. If you do your mobility exercises and loosen up your joints for 3 to 4 repetitions, even that is going to be helpful. And for you are using this as a warm-up, do it for 8 to 10 repetitions. I guess I have explained everything for that.
Yeah. I think that was specific timing if he wants to follow like that. So that was good. Meren has asked, my weight is 106, BMI is above 34. Suffer with osteoarthritis of left knee. It makes difficult for me to exercise. Now, this is very interesting. People, those who want to reduce weight but still struggle because of their other comorbid conditions. So, Doc, what do you suggest?
Yes. So first of all, we have to see how severe is this injury. His doctor will be advising on that. If it is very severe, then he can go for hydro exercises, water exercises, just I mentioned. So that are really going to help him, and exercise with the physiotherapist so that the pain part is taken care of. So then after that, then he can graduate to other exercises. He can do the upper body exercises that you can do very well in the gym, like pull up, your shoulder press, your chest workout. That can be done very well. And for walking part, I think if the knee is good enough, then he can do the electrical or all this. There are so many alternative exercises available that he can do. But of course, we must know exactly what kind of injury he's having and the level of inactivity in that knee joint
Yeah,
is there.
yeah,
But other,
true. So now there is an advancement in the physiotherapy also with anti-gravity treadmill. So that is also very beneficial for people like this. So
yeah.
that is also very good. Okay, next question is being asked by David. Intensive exercise is popularly known as a good for weight loss, what precautions to be taken?
Yeah, precautions to be taken. Yes, uh, you have to be a little bit at least intermediate level. A beginner level, please do not try high intensity exercises just like that. Learn what are those. See how much your cardio active health is, cardio and fitness health is. Secondly, how much is your weight? If your weight is too much, and if you have that weight is causing some problem in your knee joint or your ankle joint, I will not advise you to go just into the high intensity exercises. But those who can do, they can, of course, they can do it. They are really good. And whatever the session is that they can do it. Or you can, you can say, like I said, 5 minutes is the maximum what I advise. So even if you're walking, so you can walk brisk walk for 3 minutes, and you can walk or run for 2 minutes. Even that is called as a high intensity program. So this way also you can do. Instead of running the whole track, you can uh, jog and run, jog and run. Even that is going to help. And this high intensity can be not only in your running, but it can be done in your weight training also. So you are maximizing your weights and repetitions. So even that is going to go into the high intensity. So again, all this is depending on how is your condition, or how your body is taking this.
Yeah, thank you. And we have received many questions in WhatsApp as well as in support mail also, but I will be taking one question which is very interesting. One of the participants, when he came for first phase weighing, and he said, Ki, I overheard you saying, means I was talking to many people, and you were saying to do regular exercise for an hour, and I'm doing that, but still my weight is negligibly reduced. My sugar levels are still high. Now, doc, what is your view? What mistake the person is doing?
Yeah, first of all, how much is his weight, how much is sugar, and is he regular with his doctor for both the things? Is his sugar is getting under control? Then it is good. Then thirdly comes his lifestyle. What are he doing for his sugar? Is he having a regular meal timings? Is he counting his portions? What kind of food he is taking? This is one part. Secondly, he's saying he is doing exercise for 1 hour.
Yeah.
So what kind of exercises? Is he just walking, or with the
No,
walk?
he has mentioned only walking for 1 hour.
Yeah. So walking only is not going to help much in the weight loss. With the walking, you have to have some muscular exercises. Just like I said, good muscles mean good metabolism. Good metabolism means more energy is spent, more glucose is spent. So these exercises are going to help you in your glucose also monitors, and exercise and weight loss also. So start uh, doing muscular exercises, that is stamina exercises, or as we spoken, calisthenic exercises. Just for 2 to 3 weeks in a day, in a week, for 1 hour. Start doing that.
Yeah, I think if we add calisthenic into it, then it will be very good. Okay, I don't think so. I'll be taking more questions, but on the last, your takeaway message in 2 lines, Doc.
Takeaway message. Takeaway message is just do it. You have to do it. Don't think, okay, what will happen, how will happen. No, start doing it. Everything is going to happen. And yes, have a positive mentality. And of course, knowledge. So whatever we have heard today, take the points. Take what is resonating with you and stick to that. Consistency, do and consistency. Yeah, this is my takeaway.
Yeah, true, true, true. There is one more question, but you have already answered for Marin regarding the osteoarthritis. Jeffin is having a disc problem and back pain. What exercises can be done? And one more question, Susama is asking, I am doing exercise, just started weight loss program, yoga daily, but today was excellent. Okay, that was one. About the desk problem, the answer, I think, may be the similar what you have given to Mirin. If you want to add anything extra for desk problem.
Yeah, no, it's the first and all of is your doctor's opinion. You cannot do on your own. Okay, this is just a little bit. I will stretch. I will do put some balm and all, and say no. Please do not do that. Go to doctor, take his opinion. Then you can start all these things. If you're sitting for a longer duration, again you have to get up and do some stretching exercises. Simple like cat and cow exercises will help if there are no other major things found in by the doctor. So there are other things you can do. There are specific exercises for low back pains and for sciaticas also that can be done. That we can advise them if they want. What are the exercises can be done?
Yeah, thank you, Doc. Two participants have asked one thing. For everyone, these recordings are being posted on the webinar archive in the website. Whenever you log in the dashboard, you can see a webinar button. And in that button, there is webinar archive. All the previous recordings are being posted over there. You can watch anytime according to your convenience. And regarding Arabic version, the health tips are being sent in Arabic also, English, Hindi, and Arabic, all three languages. But video recordings, unfortunately, we are not having Arabic speakers. But if you you can get a Google translation for that, and you can get that. From my side, I am over. Thank you very much. Professor, over to you.
Thank you, Dr. W. Before I say thank you to Dr. Madhurima, which I will do, of course, which I certainly will do, a sentence from Dr. W caught my attention. And this was the question that my blood sugar levels are not dropping. What should I do? My thought on this issue is simple, that there is a difference between illness and wellness. Okay? Let's consider these two concepts, illness and wellness. I believe that in all areas of illness, you must refer to your doctor, because that is where your solution will come. And your wellness your wellness activities like exercise and diet are completely supportive to the disease situation, which means that if you have diabetes, your primary referral will be to your doctor, who will advise you and manage your case, and your health professionals will support you by giving you appropriate diet and exercise, etc. But if the ailment is not improving, your solution will come from your doctor. In disease, in illness, this is what I think. But I have to tell you that in the wellness aspect, everything that Dr. Madhurima said and everything that our dietitians say is most important. This is primary. This will prevent disease. So all our health professionals are tantamount or are responsible to prevent disease, and they support in the improvement of the ailment. It is the doctor who is responsible for reversing the disease, and our health professionals will support him. Well, I hope I have not confused my audience. At my age, I frequently get confused myself. Nevertheless, please take that as it is. Dr. Madhurima, I have to thank you, ma'am. I have to thank you. That was an excellent program. I've already mentioned that you gave me a few insights on how to manage the plateau. I am absolutely delighted with that. Thank you so much, Doc M. And you know that we are going to be turning to you time and time and time again. You are a strong support system for Arabian Wellness. We truly appreciate it. Thank you, ma'am. My audience, thank you so much. I don't know whether I should say my audience or Dr. W's audience, but whichever way it is, between Dr. W and me, we thank the audience ever so much for coming time and time to these webinars. Yeah, we of course thank our support staff for helping us to run this IT, my Arabian Wellness team, and so on and so forth. And I can see that the next program for next week, Dr. Wilku is always a week ahead of the rest of us. Well, the next program for next week is on your screen, obesity and skeletal load. And this will be on Friday, the 28th March from 11 a.m. Friends, Dr. Wilku, and especially Dr. Madrima for today, thank you so much and have a great day.
Thank you. Thank you, Professor.